All three of these mothers have one thing in common.
I was pregnant and using fentanyl.
I just knew that, we both had meth in our systems and that we needed to get clean.
Their babies were born with drugs in their systems and withdrawal symptoms. It's called neonatal abstinence syndrome, or NAS.
I felt guilty every day. Every day I was crying because of the guilt and shame, and I didn't know really how to ask for help.
Federal records show the number of babies born with NAS across the country is going down. But the King 5 investigators found Washington faces a troubling exception. A recent Washington State University report reveals in 2022, babies born withdrawing from drugs dramatically exceeds the national average by nearly double. But where I am right now, Spokane, it is dramatically worse. According to the WSU report, Spokane is at the epicenter of this crisis, labeled as an area of heightened concern. In Spokane County, nearly 3.5 times the number of babies are born with NAS compared to the national average.
And is it concerning?
It is concerning. It's telling me that we have too many families that are not getting the care they need and not getting the support they need.
Why would that be? Why would Washington's, and specifically Spokane's, numbers be so much worse than the national average? The researcher of this WSU report says our homeless problem could be one of those reasons. Research shows substance abuse is more prevalent in homeless populations. Washington ranked third nationwide for homelessness in a 2024 congressional report, trailing only New York and California.
We know that there's a big correlation or strong correlation between having substance use disorders and having mental health issues, being in poverty.
And so what else is there to do other than do drugs? And that just kind of numbs the depression or whatever that people are dealing with being homeless.
Mothers like Erin say it could also be Washington's lax approach to drugs. In 2021, Washington downgraded drug possession to a misdemeanor.
There's not really very many punishments for people doing drugs.
The assistance ends up just allowing them to continue to do drugs, but more comfortably.
As for Spokane, the federal government says it's a cesspool for drug activity. The DEA says it's a central hub for narcotics distribution because of its close proximity to Canada and I-90.
Do you think that Washington is doing enough to help moms and babies in this type of situation?
Probably not.
No.
State leaders say treatment has to be the priority to tackle the state's fentanyl problem. Maddie's Place in Spokane is the only place in the state and one of 4 in the country that provides housing and treatment for mothers and their infants together.
I hope that people will see that this place fills a big need.
Maddie's Place has served as a lifeline for these 3 mothers in various states of recovery.
Oh, you little stink bug. Stinking cute.
There's no resource in the state that provides what we're providing, which is to the mom and the baby during this critical time period, where you're actually licensed to treat the baby, and then at the same time, you're really treating the mom too. This area is where our mom's team is located.
Maddie's Place president and CEO Sean Cross says their model is a success. Since opening, they've served 122 babies, with 95 staying with their parents, rather than going into foster care. He says they're also cheaper than a hospital.
So we're really changing the trajectory of the infant's life and the trajectory of the parent's life.
Despite its success and plans to expand, the organization is facing a crisis.
We are at risk of losing our funding and not having it continued, and so we're at risk of closing.
If Maddie's Place loses its state funding, it could close in 2 months. They're asking the legislature for $2.2 million. It's money that would be added to the governor's already strapped budget. Advocates argue the high number of affected infants means Maddie's Place needs to be a priority.
Unfortunately, there's a lot of people out there who need the same help we did, and there's just not places for it.
We should have alarm bells that are going off, and I don't care what the budget crisis is in the state of Washington. This should be our number 1 priority, is dealing with this. We're in a free fall.
Maddie's Place should know their fate by this weekend when the governor finalizes his budget.
Kristen, it just takes so much courage to speak out about these types of struggles. What motivated these mothers to want to speak about their addiction and their recovery?
They are brave. I mean, they sat down with me, 3 of them on camera with their babies. It doesn't happen often, right?
Yeah.
And so I do think it shows how unique Maddie's place is. We have seen the data. We know this is a problem. And they decided to go on camera to talk about some of the worst moments in their life, their struggles with addiction, because they truly feel that Washington needs to make this an investment.
Amazing courage. Thank you, Kristen.
Hard to see it. And you can see a lot more from the King 5 investigators in their monthly spotlight streaming right now. Download the King 5 Plus app on your TV and you can watch for free.